Chronic pancreatitis is an inflammatory disease of the pancreas characterized by the progressive destruction of the organ's secretory tissue. Among the most characteristic symptoms of chronic pancreatitis is pain, a rather specific type of pain. It occurs after eating in the epigastric region or in the left hypochondrium, and it may radiate to the left subscapular area. Patients suffering from chronic pancreatitis also report nausea after eating, especially following dietary indiscretions. Excessively fatty foods, smoked, overly spicy, or acidic foods can lead to an intensification of the pain syndrome. During an exacerbation of chronic pancreatitis, the patient may also experience vomiting of undigested food, which temporarily brings relief. There is a myth that chronic pancreatitis is necessarily identical to diarrhea syndrome. The myth states that with chronic pancreatitis, the patient will experience looseness, stool, or alteration in its consistency in the form of mushy stool, with undigested food, foam, several times a day. This is not entirely true. It is about exocrine dysfunction of the pancreas, a situation where the acinar tissue, that is the tissue that secretes enzymes for digesting food, is depleted by a chronic inflammatory process, to such an extent that it is unable to release a sufficient amount of enzymes at the necessary phase of digestion to digest the volume of consumed food. This can result in loose stools, the presence of undigested food in the feces, as well as diarrhea syndrome. It is important to note that long-standing chronic pancreatitis with exocrine dysfunction of the pancreas will inevitably lead to changes in the patient's nutritional status. This means that all the necessary vitamins and trace elements that should have been absorbed in the small intestine, due to enzymatic insufficiency, cannot be fully absorbed. Thus, the patient may experience progressive weight loss, increased hair loss, and brittle nails, as well as dermatological issues and other symptoms characteristic of vitamin and trace element deficiencies. When assessing the nutritional status of a patient who has been suffering from chronic pancreatitis for a long time, it is also very important to measure the levels of vitamins and certain electrolytes in the blood.